is a well-known speaker in our community. He's been very active in our church for the past at least 6 years that I've been here. He's a great man and a great philanthropist of our church, and we are fortunate to have him as part of our community. I'm speaking about Dr. Andy Mecia. Today, Dr. Andy Mecia will be speaking to us on prescription for a healthy 2009. Dr. Andy Mecia is a fellowship-trained geriatrician who owns a large multi-specialty geriatric center in Fort Lauderdale. At the center, they have a neurologist, you have to excuse my terminologies here, pain management doctor, ophthalmologist, podiatrist, dermatologist, dentist, and they all do blood work and ultrasounds on the premises. He believes in providing comprehensive care to his patients so they do not have to travel from office to office. He and his associates and nurses and nurse practitioners also attend to patients in nursing homes and assisted living facilities. Dr. Mecia is involved in many clinical trials as he is a great advocate for the older patient and is always looking to improve their quality of life. He was voted one of the best geriatricians by Miami Metro Magazine, and he is a medical consultant for South Florida Channel 4 News. He is an 8th-degree black belt and president of the United States National Taekwondo Federation. Dr. Mecia is also a member of our parish council of St. David Church. It is my pleasure to welcome Dr. Andy Mecia.
Big introduction for a small lecture. Like always, I'm very happy to be here and to support my church. I know the weather didn't cooperate, so we don't have a huge turnout, but that's okay. We are all here. And this is a very important lecture. As a matter of fact, I presented this lecture at the signature grant. We have over 2,500 attendees to hear about the prescription for healthy living coming from a geriatrician. What motivated me to become a geriatric doctor, for those of you that don't know, are those people that are over the age of 50, that's a lot of us. One of the things that motivated me to become a geriatric doctor was my grandfather, who himself died at the age of 108 years of age. And he believed in taking the minimum amount of medication. He used to live up in the mountains. He was a farmer, and he used to get up every morning at 3 o'clock in the morning to work the land. And we used to have coffee in our farm. So that was our field. When we talk about prescription for healthy living, there are many ways of starting. We can start from the organ that we think is the most important, or we can start from top to bottom. It makes no difference. Regardless of where you want to start, my first advice to you is to believe in prayer. No matter how busy you are, how bored you feel, don't forget to pray. It had been studied at Columbia Presbyterian. I was in Mount Sinai as a professor of medicine in Mount Sinai Hospital. Many universities, many world-renowned universities have studied the power of prayer. And prayer for people that you know, that are close to you, and prayer for people that are far away from you. So by prayer, you are manifesting your faith. So prayer also helps us get rid of negative feelings within us and bring positive feeling. Having positive feeling within ourselves, the immune system is more apt to maintain itself in a good functioning capacity. Where negative feeling, when we're feeling depressed, we have more of a tendency of getting sick, just from the simple condition of being depressed. The immune system will also have a tendency of going down. And one of the things that I do with my patient, when they get the initial diagnosis of something really bad, like a cancer, and they come to my office so depressed and say, oh, Dr. Mecia, I went for my colonoscopy, and they say I have some form of cancer. And the first thing I try to do with my patient is to say, you must keep a positive attitude. Do not throw the towel, because once you throw the towel, the immune system will go down, and you will not be able to fight the condition. So as the Bible said, if God put you through it, God will guide you through it. So keep up your faith, and don't forget to always pray. And that's my first prescription for your soul. Number 2 is also for your mind. Try to learn to meditate. Lots of time when we hear about the stock market, a lot of us have lost so much money in the stock market, and people feel really, really down, and with good reason to be down. Again, if God put us through this, God will guide us through this. So we should keep our faith high, and don't get stuck watching TV, looking at those numbers, continue to go down, because it's going to drive you crazy. Try to spend some time with yourself, just to put some nice, soft music, shut the light down, or dim your light, and sit down to meditate, to relax yourself. Because after everything is said and done, you still have to go on. So take care of yourself. Relax and take care of yourself. By doing that, you are going to be able to solve your problem much, much better than being frustrated and trying to multitask with your mind. So learn to relax and learn to be better organized. Next is, in order for the car to work, it needs gasoline. You have to take the car for the tune-up. Your body, just like a car, it needs to go through a tune-up. For those of you that are my patients that come and see me, you know that I tell you try to come at least once a month if you can. And some of my patients say, Dr. Mecia, why do I have to see you once a month? And my answer is, it's better to prevent a disease or a condition than to treat one. And as a doctor, of course, we want to treat diseases, but I feel much, much better when I prevent things from happening. And I give you a good example. I have one of my patients that came in, and the blood pressure, her blood pressure usually was, the high number was around 120, and her low number was around 60. Well, one of her monthly visits, her blood pressure was around 135, and the top number was 80, mid-80, 84, 86. It's not a big deal, still normal, but this is higher for her than her average. So I say, don't come in a month, come in 2 weeks. She said, no, I'll be back here next week. So she came the following week, and the blood pressure now was 160 over 90. So I said, let's sit down, let's talk. We started talking. She's Armenian. We started talking about church. We spoke about the election. I just got re-elected in the parish council. We started talking about my wife and trying to help her relax.